The topic that we're going to be speaking today about is the finance of healthcare in the US and how it limits consumer choice and competition.
uh, I had never been exposed to healthcare at all until I came to United States, entered the doctoral program in Michigan State University, focused on accounting. Then hospital became such a great research setting because in California, at that time, California hospitals disclose their board background. So I used that data to answer accounting question. But then it opened the door for me to this fascinating world of healthcare. Then it's really by accident. We spend right now the $1 trillion on healthcare. That is solely paid by taxpayers and American workers. Government money always comes from taxpayers, either deceased, alive, or to be born. I would say it's highly dysfunctional, meaning that only a portion of the trillion spending is actually helping our patients, and many of the dollars spent are for, I would say, irrelevant or actually detrimental purposes.
And they're not managing risk, and they're not pricing my policy based on the risk I bring to the table. Unlike any other insurance that I buy, my malpractice insurance is rated based on where I live, how litigious it is, what specialty I have, how many claims I've had before. My car policy is based on how old my car is, how expensive it is to drive, what neighborhood I live in, what my age is, and what the risk is that I will get in an accident.
This is a great summary. Blame the game, not the player. Right? They're not allowed to do that, right? Because we have very restrictive regulations on, like the ACA and also all the public programs. So you can't rate, it's actually called a risk rating. We have to do community rating. If you choose a terrible lifestyle and I choose a good lifestyle, guess what? We're paying the same premium. If an insurance company is providing the administrative services for self-insured employers, this is really just percentage-based business. Higher spending, higher income. Insurance, as you just mentioned, for a car, for house, is really to ensure the major financial exposure. Whenever there is regulatory capture or regulated state, the purpose is, and I would not say the main purpose, but one of the main purposes will always be prevent pre-competition. Because only large ones, right, can deal with regulatory compliance costs almost, I have to say, everywhere. Whenever we see this kind of regulatory capture and we see the regulations put there, always backed by large players to fend off competition from small ones. Maybe high-risk patients might choose to use facility-based services, right? But I think majority of the patients will say, whoever's cheaper and whoever give me good services, I will go there. But that kind of feedback loop is not there when we're talking about large insurance companies.
Most accounting experts and economists will tell me that is multiplied by a factor of 7 in my neighborhood. So if I run a business that has $1 million in gross receipts, because of the employees, the taxes, the rent, the services that I use, that is multiplied times 7. If you're going to live in a free, functional capitalistic system, we have to have competition and we have to have customer choice. When everybody works for her Bravo mega health system of Long Island, there's no longer competition, innovation, or choice for the customer. The real innovation in telecommunication occurred when Ma Bell was broken up into 5 different companies, and then they had to compete for your business. The big health systems don't want to touch it, and they'll buy it and they'll close in 6 months. We can't sustain it. The other problem that I see in healthcare financing is, you alluded to a little bit about it, but it's really the cost shifting. So the person consuming the service is completely oblivious to what it costs to get that service. They think it's a $30 copay or their $50 deductible.
I believe government programs and the payment, very arbitrary payment decisions are the primary driver for this hostile environment against small practices.
Now it seems like any MBA suit can become private equity and buy a practice. The worst thing that you can do as a leader is tell a physician what to do. But if it was a physician, if it was Dr. Herb MBA, I would have given it to him immediately.
I think it's probably both. If, let's say, on the extreme side, let's say if there's such a bad intention, they want to control everyone.
Before Obama, they would have not been allowed to buy one more hospital past 30% of the beds. It's all about what the regulators want to enforce. They didn't want to enforce it to Biden's administration.
I think monopoly in many cases actually government granted, right? Therefore, I think it's politically beneficial for politicians to take power away from patients in the name of protecting them and transfer the power to large connected business interests and then get the support backdoor.
And so we're going to touch on a couple articles. Every child in the U.S. should be insured by Medicaid from birth automatically until the age of 26. Medicaid needs to be changed from a state and federal partnership to a federal funded entitlement program that will reimburse at or close to Medicare rates across the nation. If we implemented this and the government was paying 45% of Medicare rates for every pediatrician in the country, the specialty would cease to exist and there would be equity. Now, my friends who are nurse practitioners will say, we'll come, we'll step up, we'll take care of it. In America, we don't pay the school teachers well, and there's still people doing the care at what the school system decides to pay them. To me, to put the kids and with the elderly infirm at the end of life in the same bucket. What are your thoughts on someone saying this is aspirational in the future of our specialty?
I think people have different priorities and different aspirations. I'm an accounting professor. I think we don't believe money grows on the trees. If you pay the pediatricians 1/10 of what they get today, you won't get the best and brightest people to enter a practice. I think it's a common theme in today's rhetoric or narratives. And the belief that physicians will do whatever. Physicians won't. It has to be let the people decide, right? What you said, the Medicaid, the young children and older seniors, do they have superior knowledge? Or do they have a superior experience or superior morality? Why would you choose to go to medicine? Of course, medicine pay well, but also you want to help patients to start with, right? I really believe physicians are the key to change, to reform, transform our healthcare system.
Independent practice is capable to do that because they're smaller, they're more nimble, they pivot, they can do things. If I decide I want to do something in my practice, implement one of those scribe AIs, I can do that. Hospital systems are still the same, maybe with computers, they're more fancy. They have Starbucks and Panera in the lobby, but it's still the same old hospital that we worked in as interns, Herb.
Hospital said, you know what? If you want me to support you in return, you must pay me the commercial rate. That's how the deal is reached. If patients have some control of their own money, let it be Medicare, Medicaid, commercial patients, then we will have a think about restaurant. Right now, the government or policymakers want everybody to have the same restaurant, same meal plan. But if everybody controls the money, guess what? Physicians like you might choose to have Michelin restaurant. You might choose to have McDonald's. We will have diversified provider offering to cater to diversified needs. I do think how to change this, all this system, right now looks like hopeless system, is to let people control their money.
Mark Bertolini was CEO of Aetna, okay? And he came into the health insurance market out of his own personal experience. He tried to merge with Humana, but it was blocked by the antitrust regulators. When the health plan loses money, it starts looking for people to get haircuts. And it's not the hospitals and not the big groups. because they have long-term contracts with them and they can't do without the hospital. So they go after the independent physicians. Because, and I see their point. If I was a negotiator for Aetna with Dr. Rogo, I would say, you're willing to take $45 for a Medicaid patient for a 99213. Why should I pay you $46? The problem with it is that they're doing away with the independent practices. That's in their best interest.
I think if we are the CEO of those large companies, either hospitals or insurance companies or other corporations, we probably do the same. We respond to incentives.
My job as the CEO of a company is to maximize profit for the company and deliver a return to the shareholders.
Right. I also, and I want to emphasize that opportunity cost is huge. We will have only one life to live, and a great training and aspiration of physicians are compromised. A lot of innovative minds, intelligence, innovative potential being wasted because our hands are tied. So that overall create a huge societal loss. Therefore, I think we will have to recognize as a physician what we want to do versus what we can do, and how can we help remove the frictions that tying us up.
One, time is the only commodity that you cannot make back up. It often leaves a child with a lower IQ, developmental delays, and a lifelong struggle with metabolic disease. Yet we're going to spend $7 billion revaccinating everybody for COVID.
Yeah.
I'm all in for this conversation that the private market works best, but we must acknowledge, there is a space for the federal government to have investment in long-term returns. The shocking part is, I'm going to get it wrong, because when you say something like, what did you say? Something like 50% of the population spends 3% of the healthcare dollars.
Thank you so much, Dr. Bravo and Dr. Rogu. This is a great honor to be on your podcast. I'm not a physician. I always admire physicians, and this is really an honor. I would say we need to envision, right? We need to envision what a system can be and how much opportunity cost that we have incurred.
Good medicine, the money will follow. If you follow the money, you'll never do good medicine.
Mm-hmm. And if you do good medicine, money will follow. Absolutely.
Yeah.
Thank you very much for your time. Thank you very much for all those articles you write. It's wonderful.
Thank you for your support. I'm indebted to you.
No, we are to you. Thank you so much.